So you both live healthy lives. I like to believe I do as well. Would you get a blood transfusion from a younger person if you thought it would make you feel, look?
I feel like a young person.
Would you do it?
You look like a young person, feel and look.
The answer is no.
If I really thought it would work, I might.
Okay. A controversial startup that offers to fill older patients with young blood for better health. That startup is now up and running. It's in 5 cities across the U.S. The CEO and founder of the Ambrosia Clinic, Dr. Jenny Karmazin, joins us via Skype. So, Jesse, can you explain exactly how this process works?
Sure. It is a standard blood transfusion. That means it's based on, proven medical technology. There's actually 10 million transfusions each year in the U.S. There's nothing different about what we're doing, except that we're using an existing treatment for aging, which is what we think is very exciting.
But Dr. Jesse, you have to admit, yes, transfusions are there, it's very important, and they do a beautiful job with that in blood banks, et cetera. But to be honest, you can't say that transfusions are 100%.
Right, and no medical procedure is 100% safe, but like you're saying, blood banks do a really good job these days of screening for serious illnesses, and so the rates are something like 1 in several million to catch a transmissible
and then
disease.
The next question, physiologically, explain to the 3 docs up here how you feel that younger blood components is going to make you feel more youthful.
Right, there's real science behind this. So scientists at Harvard, UCSF, and Stanford and other universities have shown that molecules decline as we age, and supplementing them restores function to our brains, hearts, pancreas, liver, muscles, other tissues.
So Jesse, let's just say I roll into your clinic. Number 1, what do I have to pay? And number 2, how do I know what I'm really getting?
Right, so we work directly with blood banks that supply other hospitals with plasma for transfusions. So it's coming from the very same blood banks, and they work with us to obtain this young donor plasma. The lowest price point is $8,000. We're trying to make that even lower in the future. But that's where we are right now.
To prove that it's effective, did you do any studies where you infuse blood and you infuse like IV fluids or something like that to ask people how they felt after? And if so, how large were those studies?
Yeah, so we did a study, but it wasn't randomized or placebo-controlled, and so it's not the best kind of study.
So people knew what they were getting.
That's right. People knew it was open label, but each patient received a single dose of plasma, and we measured about 100 biomarkers before and 1 month after treatment, which is quite a ways after the treatment, and we saw real results in terms of physiologic changes in those blood tests that we'll be publishing soon, and we measured that in about 100 patients, so it was a good number.
Well, Jesse, can I ask why you wouldn't do something where we could actually have real science? Quite frankly, I feel like you guys had an opportunity. If someone wants to leverage this into a money-making operation, I'm fine with that, but why not do a good study rather than, quite frankly, a really poorly designed study?
I think it's difficult to do that size of a study because right now, blood can't be patented. So investors aren't particularly interested in funding the sort of multi-million-dollar study that you're talking about. That's the gold standard of clinical trials. So we took a trial design that's not quite as rigorous, but still gave us a lot of information about how this treatment works.
Would you at least be amenable to doing a small study? I mean, there's power in numbers, but maybe even 100 or 200 people and not letting them know what they're getting. So when you ask them if they feel better in a few months, then they don't have that placebo effect. And even that smaller study would hold more weight. You know what I mean?
Yeah, no, I totally agree. If we find the resources to do that kind of study, I think that would be the best thing for this new treatment.